This segment of Delmarva Life is brought to you by Community Behavioral Health.
Let this sink in for a moment. Studies show 2 out of 3 people have dealt with some sort of mental health issue. 2 out of 3 people. What that means is a lot of people you know have battled or are battling something right now. How do you help them? How do you show them that you're there for them? Dr. Suni Jani is a board-certified child, adolescent, and adult psychiatrist with Community Behavioral Health, and she joins us this afternoon. Thank you so much for being here.
Thank you for having me.
2 out of 3 people. Does that surprise you?
Yes and no. It's something I think I see every day, and starting to understand that that's the amount of people that would experience a mental health crisis in a lifetime. But it's also shocking more than anything, because we wouldn't want that for anyone.
Sure. So let's talk about understanding the difference between depression, anxiety, and obsessive compulsive disorder.
So they're all very complex conditions with a lot of elements to them, but I would say the main differences are that depression is sort of a low energy state for people where they lose motivation, will, and interest. Anxiety is a state where it's impossible to control worry and find that it's sort of taking over the way that you live your life. And obsessive compulsive disorder is characterized by 2 things in its name: obsessions, which are recurrent thoughts that keep entering the mind no matter how much you want them to go away, and compulsions, which are an act of some kind to make the obsession go away.
All right. So I know a lot of times people are told, you know, just keep your chin up. And I think a lot of people who deal with these kind of issues try to keep a brave face. So how are we to know they're dealing with these issues?
That's an excellent question. I would say that it's important to look at somebody's departure from their normal behaviors, and you know, sometimes you have good departures from your normal behaviors, but this could be one that looks like they might be withdrawing more from society, not doing things that they're interested in as much. Maybe you're noticing changes in sleeping and eating, so it's very subtle. But you're right, not many people will come forward and talk about this.
Yeah, and especially this time of year,
Yes.
it has to be especially tough.
Yeah, holidays have a lot of cheer associated with them, but sometimes with financial obligations, sometimes social ones, that's a stress, and stress we know can worsen a lot of people's mental illness.
So how can we tell someone we're there for them?
I think that's one way to say it, but everybody's different and everyone has different relationships. So I think whatever it is you do to try to show somebody that you have a connection, whether it's watching TV together, cooking together, gift wrapping, anything that sort of includes them in the moment and takes away the isolation, especially if you're not great with words.
Is it important for people to know their limits when talking to someone about depression?
Absolutely. Many times when people have to talk about their depression, they're talking with a trained professional that went through years of school to be able to understand how to interact with someone and their illness. But for many friends and family of people suffering from mental illness, they feel drained afterwards. So I think do what you can, show them that you're there for them in your best ability, and encourage them to seek help.
Yeah, that could probably be the best gift of all.
Yes.
Is to be present
Yes.
for the person. Dr. Suni Jani, thank you so much. Some
Thank
good
you.
information going into the holidays.